Well, thank you, Alan. Thank everybody who make this possible. I'm looking forward to hearing from the prime community organizer and candidate for the Senate, Larry Ham. The COVID-19 pandemic was mostly foreseeable and forestallable. It came from China, but it is now Trump's virus. By his bungling, delays, dismissive attitude, his constant fantasizing, his separation people from reality, his own risk taking with his rallies, he is the aider and abetter now. And that Columbia University study basically said that had he started 3 or so weeks earlier with shutdowns, it would have prevented over 80% of the deaths to date. But it still goes on. Now, it's all about Congress making the decision for single payer. I want to make this a first impression. It's all about Congress. It's all about Congress. It's all about Congress. It doesn't matter how many rallies and how many marches, critical as they are to turning around Congress, that occur all over the United States. If the energy from the citizen rallies and marches and protests go into the ether, are not aggregated into laser beam focus on 535 people in Congress, in the House and Senate, it will go for naught, and we'll have another cycle as we have since Harry Truman proposed universal health insurance fizzling out. The first thing we need to focus on is the COVID-19 is a massive form of preventable violence. In coping with it, there has emerged millions of workers who have moral and physical courage day after day. These are the healthcare workers, the grocery clerks, the sanitation workers, the mass transit workers, and so forth. They have been given huge media, personal profiles, aggregate features, and all the media, print, social media, electronic media. These are priceless assets, but they have to be organized. They have to be organized where people coming out of their ranks go to Congress and face the deniers down. Already, single payer, full Medicare in the House has 135 endorsers, all Democrats. I think it's the Representative Jayapal's bill. It happens to be an excellently drafted bill, the best one yet. And that's the focus to begin with. Now, when the veterans groups go up on Capitol Hill over the decades, it's hard for members of Congress to face them down when they make their demands, including their demands for a larger military budget, not just veteran services. In addition to physical courage, these COVID-19 workers have moral courage. The moral courage to say, this is no longer going to be a country where a corporate dominated profiteering system says to the American people, pay or die, pay or die, pay or go without for your children or your parents or your relatives or your friends. And that's why the demand has to be, it's over for the drug companies. It's over for the giant health insurance profiteering companies who make profit by denying benefits. It's a perverse incentive. That's how they make their increased profit, denying benefits and making people wait and wait, including doctors, to get paid for their services. So what we need to do is find ways to have organizers in all over the country, every congressional district, bring the most compelling people from this labor force, people who are willing to speak out, who have experiences that are heartrending, personal exposure, as well as their trust for their patients, how lives were lost in many preventable ways, how people can get paid sick leave and got sick as a result and became contagious. All these go to the congressional committees and then to the floor of Congress. It's time to recognize one thing. Sometimes when there's a major move, a mass move, things can happen extremely quickly. that haven't happened for 60 or 70 years. And that's what we're going to see. In the auto safety movement, it was considered in 1965 unheard of to regulate the giant auto companies. Within a few months, they were regulated and signed into law by Lyndon Johnson in September 1966. And that's the attitude we have to have. No more incrementalism, no more piecemeal Obamacare, no more porous Medicaid. We want full Medicare for all, free choice of doctor and hospital, coming in at half the price per capita as they do in Canada. In Canada, they cover everybody for half the price per capita, a little over $4,000. We're up to now close to $10,000 per capita. And in Canada, they cover everybody. And in the US, you have 33 million uncovered and another 50, 60 million severely undercovered. So we have to learn from Canada. They did it in the 1960s when we were involved in the Imperial War in Vietnam and diverted. And we have to learn from Canada, and we have to do it right. We have to have prevention built right in. You know, health insurance is not health care. We have to make that distinction. It just pays for health care. But health care has to be viewed in a preventative way. That's not a very profitable business, prevention. Corporations thrive off of death, disease, destruction, all the kinds of things that create economic needs in a society that can prevent them and spend the disposable income that is liberated on things that really matter to improve livelihoods and the quality of our society. Now, I wrote about 3 years ago, I wrote an article called 25 Ways Life is Better in Canada than in the US because they have universal health care and we don't. And I could have gone to 30, 35. I don't think people understand in this country because our leaders don't benefit from comparative input of other countries who do it better. And that's true for Trump and COVID-19 and other countries who've done it better, much better, because they put professionals in charge, not sleazy politicians worrying about their ego. Just think, in Canada, you never have to worry about changing jobs or not changing jobs because of whether you're going to get covered. You're covered from the day you're born. In the US, you always have to have that worry. In Canada, you don't have to worry about getting a bill. In the US, you get all kinds of bills that are inscrutable, which are all part of a larger problem that we don't pay enough attention to, which is $1 billion a day is drained away from computerized billing fraud and abuse. The site for that is Professor Malcolm Sparrow, an applied mathematician at Harvard University, and a GAO study back in 1992. That's 10% of all we spend is stolen by computerized billing fraud and abuse. That's got to be part of the attack on the current system, because when you have a single payer, it doesn't have 1,500 payers and all kinds of different micro bills that are feeding grounds for fraud and commercial crime. In Canada, you don't have to worry about networks and being trapped in networks. There are no networks in Canada as there are in the United States of doctors. You can go to any physician and any doctor, any hospital in Canada. There's a equality aspect to Canadian healthcare. It's not only affordable and accessible, it's comprehensive. And it doesn't matter whether you're a billionaire or you're working for $40,000 a year or what. You can go to the same hospital that the billionaire goes to. Now, I want you to look into that 25 ways, because the argument for single payer is not made fully. It's made mostly on economic grounds, and it needs to be made on at least 25 different ways in the quality of life, the absence of anxiety, dread, and fear in Canada compared to the US, the fear for the children, the multiplier effect of when you don't get diagnosed and treated in time. A Yale study recently came out, estimated 65 to 110,000 Americans die every year because they can't afford health insurance to get diagnosed in time. How many times have you heard the advocates of single payer point out to the massacre of people as a result of this? And if that many die, you can imagine how many more have injuries and diseases because they couldn't get diagnosed and treated in time. So the fraud, the billions of dollars of fraud, it comes up to $350 billion a year. That's about what the entire healthcare costs in several Northern European countries. And it involves the loss of life. So all right, now, here's where the COVID comes in. People are fed up. It doesn't matter whether they're conservatives or liberals. These workers, frontline workers, now have come to the same conclusion. We got to have universal health care. So when you get a liberal and conservative group of citizens coming up on Capitol Hill, it's almost an unstoppable force. Members of Congress know how to game liberals if they're conservatives or conservatives if they're liberals, because they're willing to settle for about half the pie. But they don't know how to game when they're sitting in their office and you have people from conservative and liberal backgrounds labeling themselves and saying, "Time's up, Senator. Time's up, Representative. It's over. We have the perfect bill. It's been refereed by the greatest experts in the field, like Dr. Stephanie Wallander and Dr. David Himmelstein and the Physicians for a National Health Plan. It's ready to go. It has a transition period. It's very practical. We're going to get it through the House, and then we're going to throw it up against the Senate before the election and make the resistant senators defend themselves as they go back and try and get the votes. In the context of COVID-19, in the context possibly of a resurgence, in the context of millions of people who don't have paid health care, who don't have child care. So this is the time to get this done. Now, the handbook for this is by Dr. John Guyman, who I had on my program, the Ralph Nader Radio Hour, several times. He is in his 80s. He is a hero. He actually lives on a habitable island off of Seattle and flies cancer patients to hospitals on the mainland. And he's in the late 80s. He's published 15 books. They're brilliantly clear, graphics, clear print, footnotes. And his latest one is called Profiteering, Corruption, and Fraud in U.S. Healthcare. Profiteering, Corruption, and Fraud in U.S. Healthcare. And in its various chapters, it makes the whole brilliant case for single payer or full Medicare for all. The more basic problem I haven't mentioned yet is that liberals and progressives don't know how to come to conclusions. You see all these brilliant columnists, Krugman and Nicholas Kristof and Milbank and E.J. Dionne, they're all excoriating what I have just described in the context of COVID-19 and Trump and the lack of universal health care. And then they leave at the end of their column, they leave their readers hanging. They don't come to the conclusions of their convictions. For example, with Trump, it's step aside along with Pence and allow professional scientists and managers to take control of the COVID-19. Now, you may think that's pie in the sky until you realize that there are a lot of Republicans running for election who would like that to happen but are afraid to say it publicly because they're sinking in the polls with them. So if you have Democrats wanting him to step aside and Republicans quietly wishing that would happen because he blunders and bungles and insults and stupefies and brings the worst out of people every day, then you've got something that's quite credible. But not if these columnists and these editorials don't come to these conclusions. How many editorials have you read excoriating Trump for all kinds of reasons? And there are many, and they don't come to a conclusion. Even during the narrow impeachment in the Ukraine, they didn't say, hey, Speaker Pelosi, what about the 11 other impeachable offenses? Many of them tabletop kitchen issues that people have a stake in, like refusing to faithfully execute the health, safety, and economic protection laws of the United States of America. So what I'm clamoring for here is the Democratic Party's got to wake up. It's beyond stupid. It's lost 3 out of 4 House elections to the worst Republican Party in history. It's lost the Senate. It's lost a lot of governorships in recent years, state legislatures. Of course, the failed gambling czar lost to him, compliments of the Electoral College, but he shouldn't have gotten that close in the first place. This is a stupefying, smug party. If they win the election in November, it's going to be because Trump handed it to them. That's what it's going to be because. They are not picking up on one popular agenda after another. Living wage, universal health insurance, cracking down on corporate crime against consumer abuses, consumers as tenants, consumers as borrowers, consumers as workers. They are not making minimum wage, bringing it up to 15. They're on the record, but they're not on the ramparts. They're not having deep imprint. People don't know what the Democratic Party stands for. So it's our role as civic activists in PDA and elsewhere to get real tough with these Democrats who are running for office at local, state, and national level, because they don't know, most of them don't really know how to win. They don't know how to speak on the matters that people have a high emotional and factual intelligent connection with. That's what the problem is. They should be landsliding these Republicans for years. Worst Republicans in history. Anybody who knows about the Republican Party started in 1854 against slavery knows that Teddy Roosevelt and Senator Robert Taft and Dwight Eisenhower will be rolling over just thinking of what this crass, ignorant, bigoted, Wall Street indentured, warmongering, selfish, greedy Republican Party's turned itself into. And the fact that they're even in contention, is a reflection on how the Democratic Party never looks itself in the mirror, never engages in introspection, and all it does is basically look for scapegoats like the Green Party. That's the problem. So you got to save this party from itself because it's a duopoly, and right now we're not going to change the duopoly between now and November. So you have COVID-19 is the greatest gift for single payer as it slices through the lives and livelihood of the American people with brutal force. If we lose this opportunity, it's hard to find a grassroots movement that's going to have a cutting edge and be unable to be stared down by the politicians in the years to come. This industry that is profiting off disease and death and injury and waste and corruption will never be reformed. It has to be replaced, displaced. That's what the Canadians did. They displaced the health insurance industry and controlled drug prices. In our country, when Medicare came, Lyndon Johnson wanted universal health care for all, but the Vietnam War was cited by opponents in Congress saying, Lyndon, you don't understand, we're going into deep deficits, we can't afford it. So we had a hoked up Medicaid by the state level and Medicare, which had a lot of holes in it, and these holes are being plugged by corporate profit, and Medicare is a shade of itself. It's being corporatized in the form of Medicare Advantage, a misnomer if I ever heard one, which is terribly deceptive and is luring elderly people to join it, and then they find out that it's not what you pay for, it's what you get. When they need it, it's not there. And a third of all elderly Medicare beneficiaries are now in Medicare Advantage with luncheons, free luncheons all over the country, luring in people who turn 65 and have to make the decision. So this is what we need to do. Now, the PDA has got to broaden its wings here. It's got to stand tall. We got to have a vice president who knows what they're talking about, a vice president who has experience in the deprivation of human beings and can negotiate all the BS of the corporate lawyers for the health insurance and drug and other industries. And we've got to keep the demand at a intense level personally on every senator and representative. Look, we're millions out there. Shame on us that we can't control 535 people put their shoes on every day like you and me. Shame on us. We've got to increase our own intensity here, increase our own demand level. What's the future for young people in this country? Wall Street took away their jobs in the Great Recession, so-called, with the corporate crime wave. They're having a hard time getting affordable health insurance. White-collar jobs are being outsourced as well. They can't get affordable housing. Their student loans are crushing them. And they're not mounting a mass movement with free social media. They have to worry about long-distance telephone calls and stamps. Millions of them. What are they waiting for? They can surround Congress with 500,000 people day after day, shouting with bullhorns until inside Congress they pass the laws that they need. I've laid all this out in a fable. I have to make young people laugh themselves seriously. So I put out a fable called How the Rats Reformed the Congress. And after you get over the rats at the beginning of the book, shaking up the Congress, you have a blueprint for how you can make this happen. And it doesn't take more than 1% of the American people, 2.5 million adults, spread out in congressional districts, representing an increasingly overwhelming public opinion, knowing what they're talking about, the Jayapal bill, and focusing on the two members in person, where you summon them, you summon your senators and representatives to your own town meetings. You ever thought of that? You don't go to their town meetings, choreographed and rigged. You summon them to your town meetings, telling them you're we the people. We the people. That's the preamble. Didn't start we the Congress, we the corporation. Start we the people. And you summon them to your own town meetings. And they're by now pretty briefed about health care and all the problems. So they're not going to look at you with a glassy stare and say, well, we'll take that under consideration and study it, young people, and go back to Congress without any reins on them. You say, what's your answer? What's your answer? Before you leave this town hall, we want to know what's your answer. Are you support the Jayapal bill or don't you? And the same thing can be put in the U.S. Senate. And the summons, the actual formal summons, is in How the Rats Reform Congress. And you can get it by going to ratsreformcongress.org. People are ordering it 5 at a time, discounted. Maybe they're having living room discussions, which is what so many social justice movements start, out of the living room into the streets, into the plazas, into the squares, and then into the decisional forums. I think the Black Lives Matter movement has got to become much more specific in its demands beyond the police demands. It's got to become much more specific. They know all about these crimes against them, these economic crimes. The more they broaden it out into health care and living wage and affordable housing and decent mass transit and a future that they can believe in, the more broad-based the movement becomes. Okay, that's what I have to say. ratsreformcongress.org, and you'll see the blueprint is right there. There's a lot of experience in that book, even though it's called The Fable. Thank you all.
Well, thank you so much, Ralph. Hold on one second. I'm going to give Dr. Bill a final word with Ralph. I do want to say that we have some great people on the phone listening in. We have Michael Leidy, a PDA and one of the great national advocates for Medicare for All, and a guest on the Ralph Nader Radio Hour. We have Dr. Walter Sue. We have Paul Alexander, a great ally of PDA from New York State. Russell Green, Dorothy Reich. Russell Green leads our environmental portfolio at PDA. And so we have a great number of people listening, including Steve Scrovan, the co-host of the Ralph Nader Radio Hour with Ralph Nader. So
I might say, just let me interrupt. You can get the 25 ways that I mentioned by going to singlepayeraction.org. That's got a great website, singlepayeraction.org. And you listen to the offer that Dr. Gaiman has given us. If you want his book sent free to your senators and representatives, all you have to do is send your name and address to Dr. John Gaiman, Geyman, MD, and he'll do it for you from Seattle, Washington. I don't have his email. It's something like jgaiman at wu.edu. He's taught at Washington University, so it's jgaiman, Geyman at wu.edu.
You mean University of Washington or Washington University in St. Louis?
I think it's University of Washington, Seattle.
So that'll be easy to figure out. That email, the .edu with the UW, whatever the University of Washington email is, you can find that online. And Jay Gaiman would be JGEYMAN to everybody. So thank you so much for joining us, Ralph Nader. But Bill, Dr. Bill, take it away as you say a quick word to Ralph, and we'll move on to Larry Ham in just a moment, who's running for U.S. Senate in New Jersey. And like Ralph, they know each other from their days as activists and going all the way back to Princeton University. But take it away, Dr. Bill.
Great. Well, thank you. Thanks so much, Alan, and thanks so much, Ralph. I'm a retired emergency room physician here in Orange County, California, and have spent my entire career watching people fall through the cracks of our non-system that we have, and for healthcare in this country. And now, COVID-19 is just the epitome, as you said, the opportunity, and clearly, just a shameful result of not just incompetence, but the design, to keep us unable to deal with a public health crisis by not having a public health system per se. So my question is, actually it came up in the chat too, a number of us in California especially are trying to push Speaker Pelosi to pass the damn bill. That's our hashtag, pass the damn bill, because we want a vote. We want it taken to the floor. We have 118 co-sponsors for the Jayapal bill, HR 1384, and that's usually more than enough to take the legislation to the floor. So what do you imagine we need to do to get Pelosi to actually move that bill to the floor for an up or down vote?
You start in San Francisco, which is her district, with people in San Francisco who are overwhelmingly for single payer. It's a progressive urban hub. And she goes back and forth, and you ask to meet with her face to face. Otherwise, you'll spend all your time trying to get through the flacks and the voicemails, and you never get through. So she does go back and forth, and you just have a demand of physicians, lawyers, mechanics, teachers, you name it, a whole broad-based petition summoning her to a town meeting. That's one way you start. The second way is you get the Progressive Caucus to ask her for a vote. There's about 70 people in the House who belong to the Progressive Caucus, people like Jamie Raskin and Yarmouth, and people who are well respected by her, and they can make the ask as well. So she gets pressured from back home, and she gets pressured from the Progressive Caucus. Her principal privately declared concern is it'll never happen in the Senate. Well, this attitude of not bringing bills to the floor in the House, which would pass because she has a majority, because it won't happen in the Senate with McConnell, is defeatism on steroids. You get it past the House, you make it a campaign issue, you get a lot of publicity, you get TV, you put the pressure on. I've never heard of a House Speaker have that attitude. But those are the two things. And the third one, and this is key, she's worried about 15 or 20 Blue Dog Democrats, afraid that they'll lose votes if single payer becomes an issue in their district. And whoever's in their district with PDA and elsewhere, and they're easily identifiable, Alan, others can tell you who they are, and you show them how it's a popular issue. Good heavens, I mean, it comes in majority polls, including doctors and nurses in some of these districts. So if you can relieve her of that, because she feels her job relies on those blue dog Democrats getting reelected. I don't think she realizes she's going to get a wave election way beyond those blue dog Democrats. But she's a very cautious person, and her caution has cost the House Democrats 3 out of 4 of the last congressional elections. And those are the 3 pincer movements: the San Francisco base, the Progressive Caucus people, and one of whom is chairman of the Rules Committee, Mr. McGovern, that's pretty senior, Massachusetts, and working on those 15 or so blue dog Democrats just to show them and her that this is a popular issue. This is not an issue you're going to lose votes with, especially in COVID-19 times. You can get some of those frontline workers bolstering up those blue dog Democrats, so they turn around and say, that's a winner. We're going to win votes. We're going to put our opponent on the defensive here. You see, you have to realize how dumb the Democrats are. They have no candidate opposing Senator Tom Cotton, not a single candidate. He's running unopposed in Arkansas for re-election. So what is he doing? He's taking his millions of dollars and putting ads in Ohio and other swing states against the Democratic candidates in the Senate and at the presidential level. See how stupid they are? They let millions of dollars be unleashed, where if they had a candidate, this is Clinton land, it used to be, we could hold him down in Arkansas and make him spend his money in Arkansas. So don't ever think that you can overestimate the stupidity of this party. You got to take control of it.
Well, thank